My name is Prof Marleen Temmerman. I'm a medical doctor, an obstetrician gynecologist, many years. I'm also a mother, a wife, a daughter, and a cancer survivor. I was diagnosed in 2008 with my cancer, and it came really as a surprise. I'm a very busy clinician, and I have seen in my clinic many women with cancer. So I was so used to talk about it with my patients, but never thought it could happen to me. So one day I was indeed also diagnosed with my cancer, and it came really as a kind of a shock. You know, I remember that the doctor who informed me, I just heard the word cancer and then nothing. Even if I know all the technical things, I didn't hear a word anymore. It was like when you hear that word cancer, you are already thinking of I'm almost dying. So I went home, talked to my husband, to my family, and then only 2 days later, coming back to the clinic, it were 2 terrible days. Coming back to the hospital to really have a consultation, to have the diagnosis, the details, because with just a biopsy very often a doctor cannot tell you what stage you are. So it takes a bit of time before you know exactly what is my position, how bad is my cancer, is it invasive or not? So it was invasive, and I needed the full-blown therapy. As a medical doctor, you know the technical things, you know what it means, radiotherapy, chemotherapy, surgery, you know all the kind of things that you need to come to a diagnosis. So that makes it easier, but the diagnosis is for everyone a serious blow. Now, what I think, what I've learned from this, is that we as doctors, we talk technically, and even if we take our time, which is good, but not enough. We have to learn in our training and in our postgraduate training to understand that the patient who is sitting in front of you, surely in the early phase, doesn't really understand, even if that patient is highly educated. You know, so we need to learn more on the communication, and of course we work with a team, but we as doctors, we kind of do the technical thing and we leave the communication to others in our team. I think we should be more empathic and more engaged and more knowing what that patient in front of you really thinks, really feels. My support was mainly my husband, my son, my parents, my neighbors, my friends, but mainly the close family, because you live with them every day. So it's important that they also are involved in the communication so that they know what is going on. Sometimes they hear more than the patient. So when you go back home, you repeat, you can, digest it a bit. So the support of the family is really key. My treatment plan, like for all patients with early stage but invasive cancer, was the surgery, the radiotherapy, and the revalidation, in many aspects of the cancer. So it took time, it took about 3-4 months that I was out. Initially, it was hard to cope with it for me because I'm somebody who is working. And now being a patient was difficult. So for me, my diagnosis and treatment was now 17 years ago. I went quite early, but honestly, I didn't go for the first signs and symptoms. So I could have gone a bit earlier, 6 months actually, and it could have made a difference. Maybe the treatment would have been less invasive or less severe if I had gone earlier. So I call upon everyone, please go as early as possible. If you feel something in your body, or even if you don't feel, but there are screening tests available, please do go, let yourself examine it and treat it and be aware of it as soon as possible, because early detection can save lives.